شهر رمضان الذي أنزل فيه القرآن هدى للناس وبينات من الهدى والفرقان فمن شهد منكم الشهر فليصمه ومن كان
أعوذ بالله السميع العليم من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين. Inshallah, we shall continue with our discussion on health security, that is, ensuring health security in the society. Today, we shall continue by looking at health security. What is health security? Remember, the topic is ensuring health security in the society. So we have to understand what really is health security. What do we mean by health security? And then what are those things that we need to ensure health security in the society? Now, the WHO, that is the World Health Organization, describes health security as the activities required to minimize the danger and impact of acute public health events that endanger the collective health of populations living across geographical regions and international boundaries. So what this means is that when you say health security, we are looking at guaranteeing public health. We are looking at ensuring the safety of the health of the people in that population. Now, health security spans across geographical regions. So, for example, in Nigeria, when we want to plan for the health security of Nigeria, we must also plan along with other countries in the region. So it's something that is activities or measures that take place across boundaries, so that if anybody is living in a particular country to any of those regions in that area, he is covered under the plan, the health security plan of that particular country. Now, health security has 4 types. It covers 4 different types, and all of them are more or less underscoring the importance of health security. The first one is biosecurity. Okay? When you say biosecurity, it refers to measures aimed at preventing the introduction or spread of harmful organisms like viruses, bacteria, and what have you, to animals and plants in order to minimize the risk of transmission of infectious diseases. So for biosecurity, you want to ensure that any kind of virus or bacteria coming from plants or animals are nipped in the bud. For example, we had Ebola some years back, and we had to contend with the fact that this virus came from an animal source, okay? And we had to see how we can prevent further spread, even though it actually had a lot of damaging effects on the population. The same thing with Lassa fever and even the COVID-19 that we have. Many of them are from an animal source. So biosecurity looks at the source, these viruses, and looks at how it can mitigate this spread or this infection. So it takes care of the source and ensures that it does not spread. The same thing with bacterial infections, like you have tuberculosis and several other bacterial infections that can actually spread so fast. So biosecurity focuses on those and nips them in the bud. So it looks at infections from animals and plants. Now, for human security, that is the second type of health security. And human security just looks at ensuring freedom from want and freedom from fear. So you want to ensure that the population is not poor, or at least there's a minimal level that you can treat the population so that they are not in abject poverty. The second part of human security is freedom from fear. So all those threats that brings fear or that breeds fear in the population are nipped in the bud, and that problem is tackled. The third type of health security is national security, okay? And this national security was originally conceived as protection against military attack. But now, national security is now widely understood to include also non-military dimensions, including the security from terrorism, from minimization of crime, economic security, energy security, environmental security is also part of national security. Then we have cyber security, whereby the internet, people can actually cause a threat, can pose a threat using the internet. Then you have food security. That's also another form of national security. So you find that all of these types of security, they are all part and parcel of national security. Then the fourth type is the global health security. And when you say global health security, it's defined as activities required that is both proactive and reactive to minimize the danger and impact of acute public health events. So proactive measures are taken, okay, and reactive measures are also taken to ensure that any of these acute public health events, like pandemic, like conflicts, like disasters, all of them do not endanger the health of our people. So these are the four types of health security. And now we want to find out what are the threats to health security. Having defined what health security is, having explained the four types of health security, we now want to look at the threats. What are the threats? Now, there are different threats to health security, but there are two important ones that we'll first of all mention and explain, and we'll now go on to the others. The first one is infections. Infections pose a major threat to health security. Infectious disease outbreaks have been increasing over time, and they have the potential to threaten global economic. So many of these infections, they can actually threaten the global economy. How? Because they cause a lot of morbidity and mortality. When we say morbidity, we mean hospitalization. And mortality, we mean death. And this is expensive. This means we have to spend more on hospital bills, more to prevent fatalities like death. So this happens a lot in developing countries. Then the second major threat is pandemics. Pandemics have the potential to destroy the global GDP. For instance, in 2003, the SARS epidemic was estimated to have cost between 40 to 80 billion US dollars. SARS simply means severe acute respiratory syndrome. Now, in this our time, we also have another severe acute respiratory syndrome in the name of the COVID-19 disease. It is caused by a virus known as the SARS-CoV-2 virus. That is the severe acute respiratory syndrome COVID virus. Okay? So this is a pandemic that we are in, and is a major threat to health security. So how is it a threat to health security? We all are witnesses to the loss of lives. We all are witnesses to the loss of jobs. We all are witnesses to the loss of goods and services because of this pandemic. And that is why it is a major threat to the health security of our people. Now, COVID-19 pandemic, like we said, has destroyed lives, it has destroyed economies, and it's still ongoing. Even the so-called developed economies that could be said to have a high health security index are not left, they are also involved in this problem. If you look at the Western world, for example, as of yesterday, thousands of people are still dying. In South America, over 2,000 deaths occurred in one single day. So this is a problem, and it's a major threat to health security. Now, apart from these two, that is the infectious diseases and the pandemic, there are other threats to health security. We have natural disasters. We have earthquakes. These are examples of natural disasters. Floods, okay? These are also examples of natural disasters. Large-scale accidents, like collapsing of buildings and what have you. Then conflicts. When you have conflicts, major conflicts in war situation, for example, this can give a lot of health crises, and they pose a major threat to health securities. And of course, complex emergencies. So all of these are major threats to health securities. So if you want to ensure the security, the health security of the people, then you must prepare for many of these unpredictable threats. to health security. Now, one way by doing this is by investing in our health security. It has been found that for every single dollar that we invest in health security, it is estimated to return 2 to 7 US dollars in economic benefits. Okay? So that means there's an economic gain when you invest in health security. So when you invest in protecting the population against disasters, against pandemics, against infections, then the return, the benefit will be $2 to $7. So you are going to be preventing many of those mortalities, many of those deaths that may occur due to many of these threats that we talk about. Now, we have looked at the major threats to health security, and we have realized that it is very important to invest, okay, so that you can protect the population from these threats. The next thing we want to now look at is the requirements for health security. What are those requirements for health security? What are those things that we will need to protect the population and ensure health security for our people? Preparedness for health security is like an insurance policy for our national health and prosperity. So when we have a state of preparedness, then it's like we have an insurance for our people. Again, we need to ensure that we are ready at all times. So when we are preparing for unforeseen circumstances or crises, that preparedness must be all year round, so that if it comes at any point in time, we are ready for it. In the meantime, capacity building is needed to ensure that we can continue our effective legacy of a strong system. So the first is preparedness, okay? Preparation all the time. Secondly is capacity building. What do we mean by capacity building? Ensuring that we have a strong workforce. Our health workers must be well trained. They must be well oriented in different aspects of health security, in different aspects of preparedness, okay? Then again, a strong immunization system is very, very key. Immunization is very important to stem the tide of epidemics and pandemics. If we have a situation whereby the major part of the population are immunized against the major killer diseases, this gives us health security. And that is why there was that race for development of a vaccine to provide immunization and protection against the COVID-19 vaccine. Sorry, the COVID-19 disease. So, alhamdulillah, we have been able to develop some vaccines that are effective and safe. And as we speak, this vaccine is being administered globally to the people as a way of protecting them from the pandemic that we are currently experiencing. So immunization or vaccination is a very, very important tool for protection against the different kinds of crises, particularly the pandemics and the pandemics that we are currently experiencing. Now, we have talked about preparedness, we have talked about capacity building, and then thirdly, we've talked about vaccination, that is immunization. When we have this in place, there are strong measures that will protect us against the pandemics and against all those things that can serve as a threat to the health security of our people. Then we also have food and water supplies, ensuring that we have safe food and safe water supplies. That is, our source of food is safe, our source of water is safe. If we have this, then the problem of food contamination is taken care of. The problem of water contamination is taken care of. So having good sanitation system, ensuring that we have pipe-borne water to the majority of our communities is very, very key to guarantee health security for our people. Then again, keeping our health workers protected from infection. This also is another requirement for health security. When our health workers are strong and they are healthy and they are protected, then this gives a guarantee for health security in our nation. Currently, the first batch of vaccines were specially meant for the health workers, the frontline workers, because these are the people that will be dealing with the COVID-19 cases. And so they need to be protected so that they can continue to care for the people that have the disease condition. So once they are taken care of, then we have other group of people that can then be taken care of. For example, the elderly or those that have comorbid conditions, that is other diseases like hypertension, diabetes, and what have you. So we've been able to talk about some of the requirements for health security. We've mentioned preparedness, we've mentioned the workforce, training the workforce, ensuring that they are well protected. We've mentioned vaccination as a strong process of ensuring health security. So in the next episode, inshallah, we shall now continue with the requirements for health security. We shall also look at some of the policies and programs for national health security. And then we shall do a summary of all that we have been discussing since the first episode. With this, I want to say thank you very much for listening. Assalamu alaikum wa rahmatullahi wa barakatuh.